Hi, I'm Patrick Robinson. I have the honor of serving as the chair of the NLN Foundation for Nursing Education. This year, the NLN Foundation had the privilege of assisting 22 nursing scholars in advancing their education. Let's take a look.
Hi, my name is Kristen Schaub, and I am one of the NLN Foundation's Nursing Education Scholarship recipients. I'll be using the funding I received to implement my Doctor of Nursing Practice project, where I will use telehealth-based patient actor simulations to better prepare family nurse practitioner students to use telehealth after they graduate. I believe this project is incredibly meaningful because with the advancement of technology, telehealth is really a way to affordably increase access to care to patients, families, and communities as a whole, which may ultimately improve patient outcomes.
Hello, my name is Rosalind Jean-Louis. I study the impacts of racial discrimination and disrespectful maternity care on severe maternal morbidity outcomes among Black women in the United States. I wanted to take a moment to thank the NLN members who donated towards the scholarship for the 2022 cycle. This scholarship means a lot to me because it will help me carry out my dissertation and allow me to disseminate my results to the communities that are most affected by these health disparities.
Hi everyone, my name is Kathy Quay. I want to thank everyone at the NLN Foundation for supporting students and educators like myself. Your continued support will help me complete my dissertation and will continue to advance the science of nursing education.
Hi, my name is Esperanza Gutierrez. I also want to thank you for having this type of support for students like me with my background and with my research interest.
Hi, my name is Gail Hansen-Brenner, and my program of study or my research is focused on political astuteness of nurse educators. And I think that as we educate nurses about the political astuteness and being involved in advocating for what nurses need, that we can do a much better job of teaching our students.
Hi, my name is Carrie Geiger. My career so far has been focused on infectious disease and humanitarian medicine, and I believe that by educating nurses to meet complex challenges, we can provide high-quality healthcare to populations worldwide, even during disasters and crises.
Hi there, my name is Angel Pong. My project was to reduce health disparities for our pediatric surgical patients and families, and I'm really excited about my project, and this is a very rewarding experience.
Hi, my name is Anna Goldberg. Hopefully I will be defending in December, and this money will help lessen my burden of loans when I graduate. I'm working on gaming or gamification in nursing education undergraduate.
My name is Joelyn Chikorir. I go by Joy. I'm originally from Kenya. My dissertation is focused on cervical cancer, particularly how women acquire health information. So whether it's from health providers, is it the television, is it the radios, their friends, and all other sources.
I'm Lisa Hesser. So I focused on undergraduate nursing students in the clinical environment, but specifically nursing students with learning disabilities. So looking at the experience of the nursing student with a learning disability, any learning disability, and what it was like for them in the clinical learning environment. There's not really any research focusing on the clinical learning environment versus the academic setting in the classroom.
I am Lisa Posley. So I am looking at the predictors of nursing student self-confidence with clinical judgment. More specifically, I'm looking at a just educational cultures predictor or predictive value of nursing student self-confidence with clinical judgment. So, and it's nursing students' perception of a just culture.
My name is Priska Enoforo. A few years ago, I lost my spouse, and with the loss, I saw a challenge and an opportunity. Based on my experience during the loss, and when the pandemic hit, I started wondering, other people who are losing people, how are they coping? Then I started delving into literature about widowhood. What I found was shocking. And I'm like, I'm a nurse and I've never heard about widowhood and the mortality and the morbidity that is associated with it. And I'm like, if this is a huge problem, why are nurses not in the forefront of it? Then I started looking into the literature. Most of the literature were written by the social science people. I said, no, nursing needs to be at the forefront of this. If it involves morbidity and mortality, nurses should be the leaders. I decided that this is an area that is worth pursuing. I looked at several universities, and Duquesne University matched my interest. One of my mentors happened to be a faculty there. And when I discussed my research interest, he was excited and he wants to support me. So I decided to choose that as a place to study.
My name is Shama Amololu. So my research is on, I'm trying to develop an educational intervention to educate nurses on the discordance between hemoglobin A1C and the other glycemic control measures. And so we know that A1C is the primary indicator for diagnosing and managing persons with diabetes.
As you can see, our scholarship recipients are a very special group of nurse scholars and innovators. It is through your generous support that they are able to change nursing and affect the health of communities around the world. For your generous support, on behalf of them and the NLN Foundation, I say thank you.
Thank you, donors.
Colleagues, thank you so much for your generosity to the NLN Foundation. We can do such great things together for nursing education. Donate today for a brighter future tomorrow.